Sure. Well, thanks for having me today, everyone. I'm glad to be here. As I mentioned, I'm at LSU, so I direct the Louisiana Community Health Worker Institute there. And I've been working with community health workers for about 15 years, which is frightening that it's been that long already. But I just wanted to give you a little bit of information today about CHWs. I tend to be very interactive. So if y'all have questions at any point, feel free to jump in. Now, put things in the chat or just feel free to shout them out. I will confess, I am very used to teaching public health classes, which are 3 hours, and training CHWs for about 4 hours at a time. So 15 minutes is tough. I have a million slides. I know we won't get to all of them. I just want to start out. We can skip forward to the definition of a community health worker, which is 3 or 4 slides in. Just the main thing that I want y'all to know about community health workers is really that they are a special workforce. And I'm curious, just show of hands, how many people have worked with community health workers at all before? Anybody at all? Looks like no. Okay, cool. Well, then I'll give you a quick definition, which is on our next slide. Basically, community health workers are frontline public health professionals. The most important thing that you need to know about them is that they are trusted members of the communities that they serve. So they usually have sort of a shared life experience or similar background. And having this sort of trusting relationship helps them to serve as an intermediary or kind of link or liaison between particularly underserved communities and the formal health and social services system. So we can go on. They do a lot of work, including building individual and community capacity by increasing health knowledge and self-sufficiency through a whole bunch of activities. So we can move on and I'll talk a little bit more about those roles. I'll mention briefly, no one seemed to be shouting that they've worked with CHWs before, but you may have worked with folks who have similar job titles. Community health worker is kind of an umbrella term for a lot of similar titles. So you may have heard of people who are maybe community health representatives or promotores de salud, community navigators, outreach workers, all of those sort of fall under the CHW umbrella. And so moving on to our next, we can actually skip forward a little more. Yeah, let's talk just briefly about some of the work that community health workers do. We can actually go to the next one. So there are a lot of roles that community health workers do, and I think could be very helpful. I mean, there's plenty of evidence that CHWs are helpful in managing and helping patients with chronic conditions, including diabetes. So I just want to mention a few of those, and then we can think through how that might be relevant to the work that you all are doing on a day-to-day basis. One thing that community health workers do really, really well is cultural mediation. So many times, as I'm sure you all have experienced, sometimes you're working with patients of different cultural backgrounds that may have different ideas about um, foods that they like to eat or ways of interacting with the healthcare system. And so CHWs, as that sort of intermediary, can help clinical professionals understand a little bit more about what's going on with a community or a patient, and then vice versa, help patients or individual clients sort of understand more about the functioning of the healthcare system. CHWs do a really great job of providing culturally appropriate health education. So I know y'all were just talking about your case patient and the importance of helping her lose weight. Well, we all know that that can be a really, really challenging thing to do. And so CHWs do an excellent job of helping people understand how to change their diet, how to make lifestyle modifications in a way that makes sense. So, here in Louisiana, just as an example, we love to have our red beans and rice on Mondays. A CHW would never tell somebody, you have diabetes and you can't eat red beans and rice. They would say, well, you're going to eat red beans, that's fine, but can we substitute white rice for brown rice? And can we, change maybe the type of meat that you're cooking in there? CHWs also do a lot of work with care coordination, case management, and system navigation. If we're thinking about in the context of the patient that y'all were just talking about, that's someone who may have needed to go see a neurologist, I heard mentioned, or that's somebody who was on a whole lot of medication. And so maybe the CHW could have jumped in and helped with things like making sure that the patient could get their medication without any troubles. CHWs also do a lot of coaching and social support. And this is, I think, really, really key when we're looking at things like diabetes management. many times, again, folks need help with lifestyle modifications, and folks who are clinicians, particularly physicians, are, as you know, incredibly busy and might not really have time to sit down with someone and help them, set goals or make plans. But CHWs who are well trained can do a great job of really interacting with the patient on a long term, and helping them make great behavior change plans that are very detailed and will really help patients think about how to overcome any barriers that they may face to making those changes. They also do a great job of providing social support. When y'all were talking about your patient, you mentioned that she seemed to be maybe living with friends, but you weren't sure where her kids were, and had some experiences with anxiety and depression. Well, oftentimes having a CHW can be so important for folks who may have limited social support, or who may be experiencing challenges with mental health. Just talking to somebody who's kind of on your level, who's from your community, who looks like you, can be incredibly inspiring and helpful. So CHWs really fill that role. They also do a lot of work to advocate for individual and community needs. So again, thinking about your patient, if there were a situation where the patient in that case had something going on in their life that they maybe didn't want to share with a healthcare provider, a CHW could sort of step in and say, "Hey, doc, you might not know this, but here's what's going on in this patient's life, and this might affect the number of medications that we're giving them, or the way that we want to think about their work." And then similarly on the level of the community, this is where CHWs can really come into play. Obviously, we just talked about one case today, but you'll see lots and lots of patients all the time who are experiencing very similar issues. And so CHWs might be able to join a clinical team and say, "Hey, we've got to sort of maybe think a little bit differently about the way that we are running our practice, so we can better meet the needs of multiple patients and not just one." We can go on to the next slide. CHWs also do a lot to build individual and community capacity. And this is one of the things I think is so inspiring and exciting about them. They really focus on teaching individual patients and clients how to do things for themselves. It's not a whole lot of hand holding or doing things for people, but rather, building both individuals and communities' abilities to take better care of themselves. So, maybe they're doing things like teaching their patients how to monitor their blood pressure better, or do glucose checks and things like that. They also provide some direct services on a very limited basis, and I should be clear that those are not clinical services, but they can do something like, for example, teach somebody how to use a blood pressure monitor. They also do a lot around implementing individual and community assessments, to sort of help understand where individuals and communities are in terms of their need for services. They can conduct outreach to get people in for services, and then they also participate in evaluation and research. So that's a whole bunch of stuff that they do. I just want to stop for a second and see if anybody has any questions about any of those roles. Go ahead.
Thank you so much, Ashley. This is so nice to hear. One very simple question. It's probably going to sound silly.
No, go ahead.
My exposure, when I think of this sort of, I guess, community health worker role, I think of social worker.
Mhm.
And I have one nearby in my office, and I go to her for everything. If I didn't know where she was, how do we get in touch with these people? Because there's so many more than just my social worker, obviously.
Yeah, great question. So community health workers, I usually make the distinction between CHWs and social workers. They have a lot of overlap in their roles, but they do a great job of collaborating together as well. Social workers usually sort of gain their skills and their title by going to school and being trained that way. CHWs usually gain their title and their skills through their lived experience and their ability to relate to people. So it's really sort of a job that's based on life experience and based on heart and a desire for service. If you're looking for CHWs, it's a great question. They are very active, working throughout Louisiana in a lot of different settings. In some cases, they are employed at FQHCs. Oftentimes, they work at community-based organizations that are doing health education or health outreach. All of the Medicaid managed care organizations in Louisiana have CHWs in some capacity. Their roles look a little bit different depending on which organization they look for. And I think that we're going to see MCOs start to hire a lot more CHWs. And then they also often work for universities on interventions, research projects, related to public health or medicine, things like that. So they're kind of all over the place. Other questions I can answer at this point? Okay, we're super, super limited in time, unfortunately, and I could go on for days. I'll mention just a couple more things for y'all to be thinking about. One of the fantastic things that CHWs can do again is really around I'll say two things. One is around this sort of idea of goal setting and making behavior change plans with patients. There's a lot of evidence for CHW work in that capacity. So if you're ever thinking about how to sort of integrate CHWs into a clinical practice, that could oftentimes be a huge focus of what they do. They also do a lot around making referrals for services. So when we think about, many of the challenging patients y'all have probably worked with at some point in your life, oftentimes it's because they are dealing with some sort of issues regarding social determinants of health, right? So they are having trouble with food access, or they're having trouble with transportation, or maybe with childcare, or any number of issues. Community health workers do a really good job of making referrals for those type of services that folks need. And the other thing to think about, I know that this presentation is supposed to be contextualized on the idea of how CHWs can work in rural areas. One of the challenges in rural areas is, of course, is that a lot of times the resources for social determinants of health that may be more available in urban settings are not available. So in that case, community health workers in rural settings can do a really good job of sort of resource development by collaborating with one another and also working with local organizations. So things like community-based organizations, faith-based organizations, even local schools, community centers, libraries, what have you, to create the resources that people need. And that could be anything from creating things like diabetes education classes, all the way to thinking through things like, how are we going to get a new walking trail in our community? There's lots of very active CHW collaborations, particularly along the US-Mexico border, where they've done some really cool work to collaborate to write grants and get money to put walking trails in their neighborhood, which certainly could help folks with diabetes and any number of other chronic conditions. They can do work like collaborating with local grocery stores to change the way that foods are displayed, so that when you walk in, you see things like fresh fruits and vegetables instead of chips and soda and all the unhealthy things that are very tempting to buy and that we all enjoy. They can do work like working with the local transit authority, for example, to think about where bus routes are placed so that they are a little bit more conducive to getting people from the places that they live to the places that they need to go for work or physical activity. So CHWs can do a lot in that realm. I realize we are out of time. Again, I could go on for days since this is my area. My contact information is at the very, very end of all of this. I will talk with anybody about CHWs all day, every day. But that's my information right there, my email address. And then I also just want to point out briefly, I have included the email address of my colleague, Catherine Haywood. She is the director of LaShawn, which stands for the Louisiana Community Health Outreach Network. That is a professional association for community health workers in Louisiana. So Catherine does lots of great work. She and I and many others are currently working with the Louisiana Community Health Workforce Coalition to work on developing state policy around how we can better support CHWs in our state. So if y'all are interested in learning more or getting involved in any way, feel free to reach out to me and or Catherine anytime. I would be happy to chat with y'all.